spinal cord some enlargements and spaces. What enlargement? Actually, there is some cervical enlargement for giving the brachial plexus to the upper limb, and there is some lumbosacral enlargement to supply the lower limb. You want to supply upper limb, lower limb now? Yes, by some enlargements. Yes, actually, there is a cervical enlargement which is giving brachial plexus to supply the upper limb, and there's a lumbosacral region where you have to give some nerves to the lower limb. And what are the root values? Root values of cervical enlargement and lumbosacral enlargement? Yes, that we'll find out. But also we'll find out about spaces. What spaces? You know, epidural space, subdural space, subarachnoid space, those spaces. Okay, so what is the first thing? First thing is the enlargements. What enlargement? I told you this is the cervical enlargement. What for? It is some collection of neuron bodies. Why? To give the brachial plexus. What is the root value of brachial plexus? Root value of brachial plexus supply the upper limb with 5 root values starting with 5. Which 5? C5, and after that C6, 7, 8, and then the T1. So you are telling that this is some cervical enlargement due to collection of some neuron bodies here to supply upper limb giving brachial plexus. Yes, having 5 root values starting with number 5, C5, and after that C6, 7, 8, and T1 come from here. But what is the root value of the enlargement? It is starting at cervical 3 and ending at thoracic 2. Within that is given the brachial plexus. This is also a question. They'll ask you, what is the root value of cervical enlargement? You have to say, starting at cervical 3, reaching thoracic 2, there is enlargement. Then what is lumbosacral? It is L1 till S3. What is L1 till S3? The lumbosacral enlargement start at L1 spinal segment and reaching the S3 spinal segment. So starting at L1 spinal segment, reaching S3 spinal segment. Yes. Why? Because there are some neuron bodies, and those neuron bodies are going to contribute towards the lower limb. Can you tell me the 5 root values of the sciatic nerve now? Coming from here. If you ask me the 5 root values of sciatic nerve supplying the lower limb from here, then I'll tell you it is L 4, 5 and S 1 to 3. It is L 4, 5 and S 1 to 3, total 5 root values. But what is the root value of lumbosacral enlargement? That is a question. Remember, it is starting at lumbar 1 spinal cord and reaching the sacral 3 spinal cord. So starting at lumbar 1 spinal segment and reaching the S3 spinal segment, that is from where the sciatic nerve will come. Yeah, 5 root values within that range. Within that range. Okay. There's a question asking, who is protecting this lumbosacral enlargement? Which vertebra are around that spinal cord area? You say last 4 thoracic. Who is last 4 thoracic? T10, it is T9, 10, 11 and 12. So you are telling last 4 thoracic means T9, 10, 11, 12. Last 4 thoracic. They cover this cervical spinal cord, which is lumbosacral enlargement, protection of that area. Yes, last 4 thoracic. Some books may say 5 also, but 4, last 4 thoracic. Is a question. Yeah, everything is a question. And what is this phylum terminal? It is some collagen fibers connecting tip of the spinal cord with the bone coccyx here. So you are connecting the tip of the spinal cord with the bone coccyx down there. Yes. This phylum terminal is having 2 parts. There is a longer pial part and a shorter dural part. If we say longer is the pial part and shorter is the dural part, how will you decide the boundary line? It is actually S2 vertebra. Lower border. Lower border of S2 vertebra. Yes. What is happening at the lower border of S2 vertebra is the demarcation line. Above that is the pial part, which is longer length. Above that is the pial part, which is longer length and closely covered by pia mater. Actually, pia mater is adherent to the phylum terminal here. So it is closely covered by pia mater. Pia mater is adherent to the phylum terminal. So that is why it is called pial part of phylum terminal. Yes. And what is the dural part? Dural part is additionally covered by dura mater, becoming adherent to the phylum terminal. So now pia mater was already there. covering it, yes, and additionally some durameter has come, yes, and it is closely covering the phylum terminal adherent to it. I can't understand what is happening. Can you draw some diagram for that? Yes, let us draw the diagram. But dural part is short length and it is below the S2 vertebra level. Can you see the S2 vertebra level is also the termination of subarachnoid space? What is that? Termination of subarachnoid space. Termination of subarachnoid space is S2 vertebra lower border. Yes. Can we draw some diagram for that? Yes, we will draw now. This is the diagram. What is this? This is termination of the spinal cord and some spaces in adult. So this is some adult situation now. Yes, this is the termination of the adult spinal cord. If there is a termination of adult spinal cord, where is the coccyx bone? Coccyx bone is here. It has moved away. Now maybe coccyx bone has moved away, but still it is attaching to phylum terminal. Yes, it is. Phylum terminal is having two parts now. So what are the two parts of phylum terminal? Phylum terminal is having two parts. One is called as the pile part and the other is called as the dural part, and we want to see where is the pile part and dural part. Okay, then where it is, tell me. Do you know the boundary between the two, boundary line? Yes, I know. Tell me. I think it is the lower border of S2 vertebra. Yes, correct, you are. Lower border of S2 vertebra. So at the lower border of S2 vertebra is the boundary line. It is also boundary line for some space termination. Do you remember? Subarachnoid space terminate here. So, you know, where is spinal cord terminating? Spinal cord terminating here. What is this? This is lower border of L1 vertebra. If you say this lower border of L1 vertebra, what is it called? Lower border of L1 vertebra is called transpyloric plane. And why it is called transpyloric plane? Because that is where I see the pylorus of stomach. So that is where you see pylorus of stomach. That is why it is called transpyloric plane, which is the lower border of L1 vertebra, is the termination of the adult spinal cord. Yes, but not the termination of the covering membranes. Which one? Who is covering? You know, it is covered by pia mater. Yes, I know. Pia mater, which was covering the spinal cord, is not stopping here with the spinal cord. Then what is it doing? It is continuing down to cover the phylum terminal and ultimately fuse with the bone coccyx down there. What is this? Actually, pia mater was covering the spinal cord. Yes, but is not terminating with the spinal cord. So what is it doing? It is covering the phylum terminal below that and then ultimately fused with the bone coccyx down there. Oh, it is not stopping the spinal cord but fused with the bone coccyx there. Yes. What about the next meninges? Next meninges is arachnoid mater. And what about the arachnoid mater? As you see, arachnoid mater is converging at S2 vertebra. It is converging at S2 vertebra. You mean to say arachnoid sheath will stop at the S2 vertebra lower border? Yes, arachnoid sheath will stop at the S2 vertebra lower border. Now, once you say that arachnoid sheath will stop at the S2 vertebra lower border, I think there was a space deep to the arachnoid mater filled with some CSF. Yes, correct. It is correct. Under the arachnoid, you have the subarachnoid space, and subarachnoid space is filled with CSF, and that CSF space will stop here. Where? At the S2 vertebra lower border. So at the S2 vertebra lower border is a termination of the subarachnoid space, which is under the arachnoid mater filled with the CSF. Yes. Okay, then what is the next meninges? Next meninges is durameter. If you say next meninges is durameter, then what is durameter doing? Durameter is also converging at the same point. You mean to say S2 vertebra lower border? Yes. Now, as you say, durameter is also converging at the same point, which is S2 vertebra lower border. I think there is a space under durameter. Yes, you are correct. It is called as subdural space. So where is this subdural space terminating? The subdural space is terminating, of course, at the S2 vertebra lower border. So subdural space and subarachnoid space both are stopping at the S2 vertebra lower border. Yes. But be careful now about the durameter. What about durameter? Durameter now is going to be fused with the phylum terminal and then fused with the bone coccyx down there. Oh, you mean to say this is actually durameter, show in the same color. So you are telling that this is the durameter which is not stopping at this level but is coming down and adherent to the phylum terminal here and fused with the bone coccyx down there. Yes, that's the point here. This is the dural part of the phylum terminal and that is the pile part of the phylum terminal. The pile part of the phylum terminal has a close adherent pyometer there only. But when you look at this short distance below the S2 vertebra, this phylum terminal, which is some collagen fiber, are not only adherent to the pyometer, but additionally adherent to the durameter also. And since durameter has come additionally here, this is called as a dural portion of the phylum terminal. So phylum terminal has two parts. The longer is the pile part, which is only adherent to the pyometer, and the dural part is the one which is not only adherent to pyometer but also additionally covered by durameter, and even durameter fused with the bone coccyx down there. Now once you have that kind of information, I want to do lumbar puncture for CSF aspiration. So what I am puncturing? You are doing some lumbar puncture for CSF aspiration. Yes, then you puncture the two meninges. Which meninges? When you're doing a lumbar puncture, taking a needle, you have to puncture the durameter, a rachroidmeter, then you can aspirate the CSF. Now, I will put some anesthesia agent inside. Lumbar anesthesia. So first you are aspirating some CSF, then injecting some anesthesia agent here. Yes. I want to know, where do I do lumbar puncture? Means what is the vertebra landmark? Vertebra landmark, if you want, then I'll tell you, you should be in the vicinity of L4 vertebra. Vicinity of L4 vertebra means what? Means your needle should be passing above or below the L4. So needle should be either above or below L4. Yes. Are you trying to say that needle should be between L3-4 vertebra? Yeah, maybe. Or between L4-5 vertebra? Yes. Actually, Harrison medicine will say, Harrison 20th edition will say that it is L3-4 where we push the needle, and Gray's Anatomy 41st edition will say that we have to push it between L4-5. Actually, both are correct. In clinical practice, we do both. So you're telling that it could be L3-4 according to Harrison medicine, yes, or it could be L4-5 according to Gray's Anatomy, yes. What if I have to choose between the two? Because one question has already come. If the question has already come, then which should I follow, Harrison or Gray's? I told you, whenever there's a controversy, only follow one book. Why, sir? Because you belong to anatomy department, that's why. No. Maybe I belong to anatomy department, but I have Harrison editions also. Gray's Anatomy, I started with the 36th edition in my first MBBS. Then I have 37, 38, 39, 40, 41. All the Gray's Anatomy are there in my room. Similarly, I started with Harrison 14th edition in my MBBS, and 14, 15, 16, 20th edition are there. All editions are there. I read all the books which you read. So don't bother. I will have good knowledge before I tell you that which is the answer. It is after a lot of research. Sir, what is the question? Question was simple. It was asking, where do you do lumbar puncture? What do you answer? L3-4 or L4-5? You have to read anesthesia books also. Be aware. So this is first answer in sequence. Yes. If not found, there is a second answer in sequence. Yes. Be careful about all those things. What is the answer to this question? It is asking some wrong pair. If it is asking some wrong pair, then it is some mismatch we have to find. Yes, tell me. I think adult spinal cord transplant pain is okay. Yeah, that is okay. Pyometer fusing with coccyx is okay. Yes, that is okay. Durameter, I think durameter, yes, was fusing with coccyx bone. Yes, so this is wrong. Yes, that is the answer. Durameter will fuse with the coccyx bone. Maybe it is converging at S2, but it will continue down to fuse with bone coccyx. This is wrong. This is about the terminal extent of the various structures. So what about choice number D then? That you know, arachnoid sheath and subarachnoid space and subdural space, they all stop here. So subarachnoid space, subdural space and arachnoid sheath, they all stop at S2 vertebra. Yes. So our answer is choice number C. Yes, it is, because durameter may be converging at S2 vertebra, but it will reach the coccyx bone and fuse with the coccyx bone.